one of the veterinary technicians at the Royal Animal Hospital, and today I'm going to show you how to apply transdermal gel medication to a cat. So this is Niblet, our model cat, and I'm going to be applying it to his ears. So transdermal gel medication, you might have it for multiple reasons. It might be a thyroid medication to decrease the thyroid level. It might be for pain medication. So this is what it will look like when you receive it. It will be like a kind of a cream gel in a syringe. So right now, the syringe isn't full, but when you get it, it's usually full, and the doctor will let you know the dose you're going to be applying. So normally it's a small amount that you're going to be using. So today we're going to apply 0.05 mils of this to Niblet. And if I show you the syringe up close, right now we are at 0.065. That's where the top of the plunger matches, and we're going to be going up to 0.06. So we're going to be using 0.05 mils of that medication today. So when you're going to be using it, make sure you're wearing gloves. And that's because it absorbs into the skin. That's the whole way that the medication works. So if you're not wearing gloves, it's going to absorb into your skin and do whatever the medication does. You're going to be applying it on the ear pinna of your cat. So where that is the inside of the ear that doesn't have the hair. So anywhere in here. So I'll show you. So again, 0.05, I'm going to press the plunger up, and that little bit of medication that comes out, I'm going to put on my finger. Sorry. And I'm going to apply it to the inside of the ear. So anywhere where there's no fur, you're just going to rub it in until you can't really see it anymore. And you don't have to go deep into the canal or anything, you just want to get it on the skin that doesn't have the fur, and that way it'll absorb in. So you just leave it alone, you don't want to touch it, and it will absorb in. Niblet doesn't want to stay on the table, but when you are using this type of medication, you want to make sure you clean the ears out regularly. So just using gauze and some water, you would just wipe out the inside of the ear. So I'll just get Niblet back up. So just using a wet tissue or gauze, you do want to wipe out the opposite ear that you applied the medication in when you're applying the medication in the one ear. So I put it in this ear, so now I'm going to clean this ear just by wiping it a few times. You're going to get some kind of like creamy gunk on it, and then you just wipe it until you don't get that anymore. That way, when you apply the next dose, you're going to apply it to the clean ear, so the opposite ear. You want to alternate ears, and that way it's clean and it absorbs in properly. So each time, my next dose, whenever that's going to be, I'm going to apply to the opposite ear, and then I'm going to clean this one. And it's a very important step to make sure you are cleaning the ears. You obviously don't want to clean the ear you just applied the medication to, because then that just removes the medication. And again, make sure you're wearing gloves when you're cleaning as well, because there is some medication residue that you might get on yourself. And so that's pretty much it for how to apply transdermal gel to a cat's